A new study says gobbling up too many refined wheat and rice products, along with eating too few whole grains, is fueling the growth of new cases of type 2 diabetes worldwide.
Well, joining us now to talk about that study is Chief Quality Officer of UW Health, Dr. Jeff Pothof.
So eating junk food is not good for you.
You know,
What?
surprise, surprise. But yeah, another study that looked at, the incidence of diabetes from the 1990s to 2018. 2018, 14 million new cases, 8 million more than we would have had, 1990. And when they try to figure out, why is that happening? There's all those different factors, but what they're really keying in on is we typically eat too many highly processed foods, simple carbohydrates, and then those preserved, meats, pepperoni, salami, and things like that. And that might account for a majority of these new cases. And I think it makes sense because, one, those foods are readily available. They're all over the place. One, that they're fairly affordable, and they taste good. The problem is like long term, they're pretty bad for us. So trying to get away from the red meat, eat more like complex grains and things like that, whole grains, certainly in the long run is better for us, even though we may not enjoy them quite as much in the moment.
Well, even some of the health foods have some very processed ingredients in it. So people may think that they're being healthy, but they're not. So how can you know what you're looking for at the grocery store?
Yeah, I think, simple ways to do it. So processed meats, I think that's pretty easy. If it looks like someone's done a whole lot of stuff to the meat, that's probably highly processed. For the grains, it can be tricky because what you're really looking for are like simple sugars, simple carbohydrates, and things like that. And you're right, once you kind of dress these things up and you call it like a granola bar, it sounds like it's healthy, and then you realize that it's pretty simple sugars in there and maybe not as healthy as they want you to believe it is.
How do they diagnose type 2 diabetes? What's the tipping point?
Yeah, there's a few ways that you do it. So the most common way you're going to get it diagnosed is your doctor's going to have you go for a fasting glucose level. And if you fast and you get a glucose level and it's above a certain level, that's diagnostic for type 2 diabetes. Other tests that you'll see sometimes doctors do is something called a hemoglobin A1C. It gives a longer view of how high your blood sugar has been, and they can narrow in pretty accurately on whether or not you have type 2 diabetes or not.
And that can lead to a lot of other issues, cardiovascular issues, kidney issues, whatnot. So it's good to do the work now if you can, to avoid some of those
Absolutely.
things.
I mean, I see a lot of diabetics in the emergency department, and lots of times the diabetes in and of itself doesn't make you feel bad. And you're like, why should I be so careful? This is so much work. Until someday it catches up with you and you're having a heart attack or a stroke or something like that. And at that point, it's too late. So once you're diagnosed with diabetes, it's so important to manage that blood sugar really tightly because one day it comes and catches up with you.
I think this is the first time in 3 years that we have not talked about COVID.
There we go. That's not a bad thing.
Are we to that stage?
Things are looking pretty good. I mean, yeah, I think we are. We talk about, boosters available for older folks, and there's some variants in India, but all things point to the idea that we're kind of in this like symbiotic relationship with COVID where it's never going to go away, but we're learning to live with it.
Yeah. Herd immunity?
Probably not herd immunity. People are going to get sick, they're going to die, but enough immunity where the rate of people who are getting severely ill is pretty low.
And that's mostly people unvaccinated?
Unvaccinated, or even at this point, not even so much that. It's folks who have risk factors. So they're elderly, they have increased risk for that, they're immunocompromised.
Diabetic?
Diabetic, that would definitely count. Like, those are the folks that we typically see the more severe disease in. Everyone else has probably experienced at least once, and they've made it.
There's an old expression, no news is good news.
There you go.
Yeah, that's for sure.
Doctor, thanks for being with us today.